Hi, I'm Dr. Burkholder. I'm a board certified emergency medicine physician. I live here in Tampa Bay, Florida, and I run a concierge medicine practice, Olympic Concierge Medicine. I'm the medical director and founder of the company. And, I'm going to be talking a little bit about AI and how we're thinking about using it in our business, along with how we're already using it in our business. So, one of the things that is great is that we doctors have their own chat GPT, right? And so you have to have your own national provider identification number, basically your license number. You plug that in, and then you have a kind of a curated chat GPT for medicine where it pulls all of the latest and greatest research, and that is awesome. It really helps us a lot. But one of the things that is a pain point for really any medical practice is kind of the administrative work, the front desk, right? How people work with our business, how they communicate with our business, whether it's a patient, another business trying to help us with medical equipment or what have you. There's always that possibility for excuse me, a missed call, or say just an inefficiency in communication, right? Most people are sending faxes still nowadays because of the HIPAA laws, right? So the faxes are kind of a one-way communication where email, there's a risk always for a breach, and so that is one of our pain points, is that we'll send faxes. Faxes don't get sent all the time because they're rejected, or the fax line was busy, so we have to resend. So we're hoping that there's some tool that we can attach to our fax system and say, hey, AI, if the line was busy, can you please resend this fax? Just things like that, right? So many different examples, to even like patients calling in. If maybe our office manager is busy at the time, maybe we figure out a way where AI picks up the phone, talks to the patient, and then helps them with whatever they're dealing with. The issue with that is, if it's not administrative and it's medical, we have to train the AI such that, hey, I can't give medical advice, you have to talk to the doctor. And so that's kind of an interesting idea, that we're trying to figure out, right? Because we definitely don't want the AI um, to to give medical advice like by itself, right? It definitely needs a physician input and oversight. We're nowhere close to AI kind of taking over the role of the doctor, and I don't think we'll ever quite get there, especially for medical procedures, right? Things like that. I mean, how is AI going to do a laceration repair, right? Somebody falls, they cut their arm. How is AI gonna do that? I just don't see that until we have like highly trained robots, like medical robots that have all sorts of kind of healthcare training, if you will, and training by physicians how to do certain things. I know that you do have surgeons using robots, basically controlling them like a video game, but it's just different, right? So some of the concerns around using AI in medicine is maybe something you've heard of called HIPAA. So it's the Healthcare Portability Act, and it's basically protecting patients' healthcare information, and it's a serious thing that needs to be complied with, so that confidential medical and personal medical information doesn't get leaked, onto the internet. So there is there's definitely ways to do this. There's business associate agreements to connect with other businesses, so that all of that is kind of kept within that certain AI, and there's safeguards for that. But again, it's not perfect. In terms of scheduling, when the AI might be taking patients' social security numbers or birth dates and addresses, how do we know that the AI isn't leaking that information out, across the internet? So there's all these things that we'd like to use AI for, but we have to work out still, I think, the kinks and the ability to keep patient and personal information confidential. Um, I think that AI should never replace the human touch. Um, there's a lot of people saying that there's all these white collar jobs going away, and I unfortunately I think that's probably true for a lot of industries. I think that there's very few professions that are going to be um, kind of not impacted in a big way. But I do think medicine is going to be one of the very few that has a lesser impact because you have that human touch, right? That experience, that empathy, um, the guidance from physicians, and I think that's just invaluable. So I hope that helps you understand where a physician's mind is at in this AI boom and AI world that we live in, and I look forward to talking about this more. Take care.